Varicose veins and venous insufficiency occurs when the superficial veins in the lower extremity have defective valves. Normally, when a person stands up, blood does not pool in the legs because they're one-way valves that let the blood flow to the heart but not down to the feet. And in some patients, they've inherited weak valves from their mom or dad, possibly made worse by conditions like pregnancy or prolonged standing or obesity. But when the vein valves are abnormal, the blood pours the wrong direction down into the legs and it fills varicose veins. They can be quite painful. They can also cause problems like swelling, and in bad situations, they can result in fibrosis of the skin. You can get dark, discolored areas along the middle part of your ankle area, and in some cases, you actually can get very painful ulcerations. Another problem that can occur from varicose veins is that they can rupture and bleed. So the traditional treatments for this have been surgical stripping and ligation, but there's a lot of newer techniques that can be used to treat the veins minimally invasively. Two of the newer techniques are called endovenous laser ablation and radiofrequency ablation, and in that situation, a catheter is threaded through the abnormal veins and the vein is sealed shut by heating it from the inside out. You essentially accomplish the same goals as surgical stripping, but you don't have to strip the vein out, you just seal it shut from the inside. In some situations, if the veins are big enough, we will actually go and remove the varicose veins with something called phlebectomy, where you make a little tiny incision with a needle over the varicose vein and then put a hook. It looks like a crochet hook, and we'll pull out some of the veins. That's usually reserved for people who have big varicose veins. So the combination of sealing the abnormal refluxing vein with a laser or radiofrequency catheter along with performing phlebectomy of the bigger veins will usually be a thorough treatment of the problem of varicose veins and venous insufficiency. Sometimes we may add sclerotherapy to that. In that situation, we inject a sclerosant or a chemical medication which kills the veins. That's particularly helpful when we're not able to perform laser of a refluxing pathway. Sometimes there are abnormal veins called perforators, which are hard to treat with laser. In another situation, people will have, instead of having bulging varicose veins, they'll have blue superficial spider veins. And those are also treated with sclerotherapy, but it's important to first make sure we treat the underlying abnormal veins with laser and phlebectomy and some of the deeper injections if that's a condition that the patient has.